So, hello, Mr. and Mrs. Walters. So, I know you guys came in because your son, Alton, who is 3 years old, is showing early signs of Fragile X syndrome, which is just a genetic mutation. So, you wanted us to provide him with a happy and healthy life, and you also wanted to gain some more information for your family in regards to the carrier risk for this genetic mutation, and especially for you, Miss Walters, one of your four sisters who is 10 weeks pregnant, to make sure that there is a potential for her child having Fragile X syndrome as well. So you want to get those carrier risks all settled out, and also provide Alton with a treatment plan and just some recommendations. So if he does in fact have this Fragile X syndrome, we can provide him with the happy and healthy life that.
Fragile X syndrome is caused by mutation of the FMR1 gene, where the triple CGG repeat is done over 200 times instead of 5 to 40 times, as in the average human. No production of the FMRP protein leads to no regulation of some other proteins and negatively affects synapse development. This disease is twice as common in men, being 1 in 4,000, and in women, being 1 in 8,000. And men are also much more likely to experience symptoms. Some of the symptoms that are common in patients with Fragile X syndrome are mild to moderate cognitive impairment, delayed speech development, heightened anxiety, and hyperactivity. And many of these children will also have ADD. About 1/3 of these children will be diagnosed with autism spectrum disorder. And some of the distinguishing physical characteristics are a long, narrow face, large ears, prominent jaw and forehead, unusually flexible fingers, flat feet, and in males, many will have enlarged testicles.
So here we have the karyotype for Fragile X syndrome. So here is an X chromosome. So on the left, this is a normal X chromosome, which has a normal FMR1 gene. As you can see, it's all together and there's not any breakage, and it's one complete chromosome. But in Fragile X syndrome, there is actually a gap. So here's a little gap because of the mutated FMR1 gene. So instead of being all nice and together, it's actually separated. So here is the pedigree for your family. So this is your part of the family. So here is Alton and here is you, Miss Walters. So you are in fact the carrier for this Fragile X syndrome because men cannot pass it to their sons, but they can pass it on to their daughters. So here is your side of the family, Miss Walters. So we're going to assume that your mother is in fact the one who brought in this Fragile X syndrome mutation, because it's more likely for women to be affected by Fragile X than men. And the reason why we're having this discrepancy and we need to run more genetic testing, such as like a PCR test to make sure who has the mutated gene, is because even though men can't pass it on to their sons, they can pass it on to their daughters, and women can pass it on to their sons and daughters, as seen by, in your case, of you passing it on to your son Alton. So here we have your three other sisters. So according to this Punnett square, there's a 50-50 chance of um, a girl being born, and of those girls, half of them will indeed carry this mutated gene, and the other half will not. So Miss Walters, you are one of them, and we're just going to assume for as a safety net that Miss Walters, your sister that is pregnant, might be a carrier, but as I said before, we can run more genetic testing, so she can pass that on to her unborn child.
There is no cure for Fragile X syndrome. It is treated with therapies such as special education, speech and language, and occupational therapy. Some medications can help to manage hyperactivity and the short attention span that often come with the disease. And if you plan on having more kids, it is possible to tell whether the children are likely to have this disease. But since you have had one child with the disease in the past, it is more likely than another. Some options are available, like chronic villus sampling and amniocentesis. But results for chronic villus sampling are very difficult to interpret and require confirmatory results available into the second trimester. Amniocentesis results, on the other hand, will be available within 4 weeks of the test being ran. These tests can only determine the presence of the mutation and not the problems the child may incur. Some other options are available for having children, like in vitro fertilization, pre-implantation genetic diagnosis, in vitro fertilization with an egg donor, and adoption. There's no right or wrong answer, it's simply what is best.
So there are a couple things we can do to confirm that Alton does in fact have Fragile X syndrome. So the first thing we can do is a PCR test or a polymerase chain reaction test. So in this test, we're basically going to be making millions and billions of copies of Alton's DNA and amplifying them. So what's going to happen is we're going to take a sample of Alton's cheek cells, or we can take some blood, and then we're going to denature the DNA, basically unzipping it and creating 2 separate strands, and then we're going to be adding primers onto each single strand of DNA, and then we're going to be using a tag polymerase to fill it in for a specific gene. So we can do this test for everybody in the family. We can do it for Mrs. Walters, Mr. Walters, Miss Walters' mother, all the sisters, and Miss Walters' father, to see if they do in fact carry this specific gene for Fragile X syndrome. So if we do confirm that Alton does in fact have Fragile X syndrome, there are a couple of things we can do to provide him with a happy and healthy life. So the first main thing we can do is place him in special education programs. Since Alton's 3 years old and hasn't really started school yet, this would be the perfect time, since it won't be such a big switch and he'll be used to it and he will consider it his new normal. So basically these special education programs, it's going to be a lot more one-on-one time with the teacher, and they're really going to be catering to Alton's needs, because Fragile X syndrome does in fact, there's some intellectual disabilities in this syndrome, so it can be hard for students to learn. So in these special education programs, teachers are going to be with them one-on-one and helping them specifically with their needs, because if he was in a large classroom with everybody else, his needs wouldn't be met, and we want to provide him with a happy and healthy life. So the special education programs would be a good idea for him. And also they can send reports on how he's doing to the parents, and it's a lot more connected with the students, unlike in a normal typical classroom. Then another thing we can do is therapy. So we can do speech therapy and occupational therapy, because as I said before, Fragile X syndrome can come with some intellectual disabilities, which includes speaking. So he can go to therapy maybe once a week or twice a week need be, and he can learn how to express himself, because as I stated before, there are some intellectual disabilities. And then another thing we can do is medication. So anxiety is a big problem that comes with Fragile X syndrome. So this can be more when he's growing up and older. We can see if he needs it. So we can provide him with some anxiety medicine just so his anxiety will go down and he'll be a lot more happy and also healthy, because anxiety can lead to things like depression. So yeah. And then Miss Walters, you wanted to provide some information for your family. So what I would recommend for your sister who is pregnant is a fetal screening or like a prenatal diagnostic test. So because this would be really helpful, so you can see if the baby does in fact carry the gene mutation, so you can plan accordingly. And what I would say to your sister, Miss Walters, is that she can kind of use the same information I've given you with the special education programs, therapy, and the medication, because the child would be like Alton. And also, we can do carrier screening, because Fragile X syndrome is a dominated trait, and carrier screenings only account for recessive. And also, we can do an in vitro fertilization diagnostic test, because Miss Walter, your sister, is too far along her pregnancy, and you didn't state if she was fertilized by in vitro, so we cannot do that, but we can in fact do the fetal screening. And then also